today's class, we will be discussing regarding one of the most common disorder of the childhood, that is tonsillitis. So every child in their lifetime has been infected with this disease many times. Okay, let's see what is tonsillitis and how it will be affecting the children and what are the management. So before going detail regarding tonsillitis, let's see about what is tonsils. So tonsils means they are the masses of lymphoid tissues which is usually located in the pharyngeal cavity. So you can see the picture here. It's a picture which is giving you the comparison of normal tonsils and inflamed tonsils. So the major function of these tonsils is they will help to protect the respiratory as well as the alimentary tract from the invasion of all kind of pathogenic organisms. They also plays a very important role in the antibody formation, and usually in the children's they will be having the larger tonsils compared to adolescents and adults. So these are the pairs of lymphoid tissues which helps in the protection of the respiratory as well as the alimentary tract from all kinds of microorganisms. So we'll see what is the definition of tonsillitis. So tonsillitis means the inflammation of the tonsils. So as I said you early, so these are the pairs of tissues which is located at the pharyngeal cavity. So you can see here in the picture, here the tonsils are inflamed and they are enlarged. Okay. Let's see what are the major etiological factors of these tonsillitis. So usually it's believed that the tonsillitis is developing because of the viral etiology. At the same time, bacteria can also cause tonsillitis. So the major viral etiology which include adenovirus, they are associated with common cold and sore throat. The rhinovirus, the most common cause of common cold. Then the other major viruses are influenza virus, the respiratory syncytial virus, and coronavirus, the newly discovered virus. Then Epstein-Barr virus, herpes simplex virus, and cytomegalovirus are also responsible for developing tonsillitis. At the same time, a small portion of the disease can be developed due to bacterial infections also. So Staphylococcus aureus, Mycoplasma pneumoniae, Chlamydia pneumoniae, Bordetella pertussis, Fusobacterium and Neisseria gonorrhoeae is also responsible for the bacterial etiology of tonsillitis. Okay, so is it clear for you? So now we are moving to the pathophysiology of tonsillitis. So as I said you, the pathophysiology is mainly developing because of the viral etiology, and sometimes bacteria are also responsible for the development of tonsillitis. So because of the various organisms like bacteria and viruses, they will be gaining an entry to the respiratory tract of the child, and this will be leading to an inflammation, and as a result the child will be developing recurrent tonsillitis. The tonsillitis is the inflammation of the tonsils. So the recurrent tonsillitis which can cause the fibrosis of the tonsillar crypt. So tonsillar crypt means these are the normal anatomical foldings you can see in the tonsils. Okay, so when there are recurrent tonsils, this will be leading to fibrosis and thickening of these natural fold in the tonsils. And these fibrosis may lead to closure of the tonsillar crypt. So once these foldings are closed, they will be inflammatory processes will take place inside. This will be leading to the development of pus inside the natural foldings of the tonsils. Okay, so because of this, what will happen? There will be the closure of this tonsillar crypt, and this will be leading to the cellulitis of the crypts, as that is known as peritonsillar cellulitis. And if this peritonsillar cellulitis is going untreated, this will be leading to peritonsillar abscess, and this peritonsillar abscess is otherwise known as quinsy. This is the most common reason for the surgical removal of the tonsils gland. Okay, so this is regarding the pathophysiology of tonsillitis. So let's see what are the major clinical manifestations. So because of the inflammation, there will be red and swollen tonsils. Tonsils will be there. A white color or a yellow color patch you can see if you check the oral cavity of the child. The child will be having a complaint of sore throat, same time painful swallowing. Then, as these palatine tonsils are enlarging because of the inflammation and edema, when you open and see the child mouth, you can meet these tonsils in the midline, and we will call it as kissing tonsils, which may obstruct the passage of air as well as food. Because of this, the child may be having difficulty in swallowing and breathing, and difficulty in breathing. Because of that, the child may start to take breath through the mouth. Okay. Apart from that, because of the inflammatory process, the child will be having the complaints of fever. Then inflammation will be leading to a bad breath from the mouth, that is halitosis. Then the child will be having complaints of stiff neck and headache. These are the common manifestations elicited by the child. Now we'll see how we can diagnose this disease condition. So the diagnostic methods, first one is regarding the history collection. In the history collection, a recent history has to be collected from the child as well as the family members regarding any infections or any history of any swimming or any recent traveling, etc. Physical examination is also another method. So here the oral cavity is examined to see the inflamed tonsils. As I said you earlier, they will be enlarged and swollen. Then blood studies are also carried out in order to see whether the WBC count has been elevated or any changes in the cell parameters. Then in order to differentiate between the bacterial origin and viral origin, a throat swab culture also done. Okay. Now going to the therapeutic management. Usually the tonsillitis is not a major health problem, it's a self-limiting condition. Hence the viral pharyngitis treatment is mainly based upon symptomatic. So it is very important to differentiate between the etiology, that is viral or bacterial, because most of the infections are viral origin. Early test can eliminate the unnecessary antibiotic administrations. In the medical management, usually in the medical management, a cool mist vaporizer will keep the mucous membrane moist during the period of mouth breathing. As I said you, the child will be having mouth breathing, so this will help to keep the mucous membrane wet. Then warm salt water gargles can be given to the child. At the same time, in order to reduce the pain, analgesics, and in order to reduce the fever, antipyretic medications like acetaminophen can be given. The combination of non-opioid and opioid elixirs, then tablets such as acetaminophen can be given to reduce the pain routinely every 4 hours. And coming to the surgical management. The surgical management usually perform this tonsillectomy. If the medical management fails and the child continuously develops the symptoms of tonsillitis and it is very difficult for the child to cope up with the manifestations, usually the surgery is preferred. So it is the surgical removal of the palatine tonsils. So here the absolute indications for this tonsillectomy include the recurrent peritonsillar abscess, which may lead to the airway obstruction. So you can see a picture here. So this is the inflamed tonsils before the surgery, and next picture is the tonsillectomy has done, and that is the picture after surgery. Okay. Next, regarding the postoperative management. So following the surgery, the children are placed in their abdomen outside to facilitate the drainage of secretions. Otherwise, there are chances of aspiration. The routine suctioning has to be avoided, and if it is needed to be performed, it should be done very carefully to avoid trauma to the oropharynx. Then the child is discouraged from coughing frequently and clearing their throat, blowing their nose, etc. because these activity can aggravate the operative site and which may lead to bleeding. Some secretions are usually common, so this has to be informed to the child as well as the family members, and most of the time the nurse has to assess the secretions and omit test for any kind of fresh bleeding, because sometimes the child may be frequently swallowing, which indicate that the child is having an internal bleeding from the surgery site. So this has to be observed by the nurse. Coming to the nursing management, the nursing care usually involves providing comfort and minimizing the activities that may precipitate bleeding. A soft liquid diet can be preferred to the child. Then the nurse has to assess for the signs of bleeding. At the same time, any signs of any respiratory distress. Then, if the nurse is trying to provide any kind of feed to the child, the nurse has to take precautions to prevent aspiration. So, that is very important. So, we'll see the common nursing diagnosis. So, the deficient fluid oleum, because why? The child may develop deficient fluid oleum related to inadequate oral intake, secondary to painful swallowing. Then pain is another reason, so acute pain related to inflammation of the tonsils and the surgical procedure. Then impaired swallowing related to pain and surgical procedure. Then deficient knowledge related to caregivers' understanding of the post-discharge home care signs and symptoms of complication. The next one is risk for aspiration related to impaired swallowing. So all these nursing problems are formulated on the basis of the observation of the child. Next is regarding the dietary management. So the food and fluids are completely restricted until the child is fully alert. Till that the child will be receiving the IV fluids. Then cool water, crushed ice and flavored ice pops can be given according to the child wish. Then the nurse has to always keep in mind the fluid with the red or brown color has to be avoided, because I said you already there are chances of internal bleeding. So there will be we need to identify between is this because of the pure blood or the red colored food we have given. So because of that the red colored food has to be avoided. Then citrus juice are not given because they are poorly tolerated. Then until the wound is getting healed, the child can be given with soup, smashed potatoes from the second postoperative day. Then milk, ice creams and milk products are usually not offered because these products can coat over the mouth as well as the throat, and this will be leading the child to clear the throat, which can initiate bleeding. Okay. And regarding the pain management, so usually following the surgery, the child will be having pain. So pain medication to be given for the first 24 hours. So usually analgesics are given rectally or intravenously to avoid the oral route. And antiemetics drugs can be also administered postoperatively. Regarding the family support and home care, so the nurse need to educate the family regarding avoiding irritating or highly seasoned food, then avoiding gargles as well as vigorous toothbrushing, then avoiding coughing or clearing the throat or putting some objects into the mouth, usually the children will do, then limiting the activity like their play and all which may precipitate bleeding. Then sometimes mouth odor as well as slight ear pain is very common for a few days after the surgery. This has to be informed to the parents, and also inform the parents regarding a low grade fever. Then most of the children they will be ready to resume their normal activity 1 to 2 weeks after the operation. So till that the child has to be cared in the home. So all this instruction has to be given to the family members. Okay. So this is regarding tonsillitis. So I think you got an idea regarding tonsillitis. What are the causes? What are the manifestations? How we can diagnose? And what about the management, including medical, surgical, nursing, dietary management, and home care management. So regarding the details, we'll see in the notes. So thank you.